So when to take ginger and when not to take ginger, that's what we're going to talk about today. Ginger can be a powerful remedy for so many things. It's been around for thousands of years. It's been used on ships to prevent scurvy. Confucius, the Chinese philosopher, not just consumed it every day, but he consumed it every single meal. In the 14th century, a pound of ginger cost the same as buying an entire sheep, so it was very expensive. Ginger was one of the first spices to be exported from Southwest India. And ginger has very high antioxidant levels, only to be surpassed by pomegranate juice. Now, the benefits I'm going to tell you are based on a paper that looked at 190 articles on ginger. From that, 43 met high quality evidence. Ginger has many, many effects: antimicrobial, anti-inflammatory, anti-diabetic. There's anti-cancer properties, especially colorectal. It's also great for menstrual pain, arthritis, increasing HDL, as well as improving heartburn. But ginger's biggest effect that it's known for is its ability to get rid of feeling nauseous. So it creates an anti-nausea effect when you're pregnant, going through chemo, when you feel nauseous, when you're having a menstrual cycle, as well as after a surgery. I remember when I had my shoulder surgery, I came out of it and I felt very, very nauseous. So anytime you feel nauseous, think ginger. In fact, they compared vitamin B6 to ginger, and ginger was more effective than vitamin B6. There's some contraindications that you need to know about. In other words, if you're taking ginger and you have the following things I'm going to talk about, you need to stop taking it. If you're on Warfarin or you're on some type of blood thinner or aspirin, because ginger helps you thin the blood. And if you're on a blood thinner and you're taking ginger, you're going to thin the blood even more. And also, if you have a bleeding disorder, I wouldn't take ginger. Now, ginger also inhibits insulin. So if you're taking insulin, you have to be careful because it's going to bring your blood sugars down. But of course, the next question is, if we compare medication to ginger, there's probably less side effects from ginger. And so why wouldn't you just want to take that? You can talk with your doctor about that. But I mean, it just fascinates me that when I was in practice, some people would take natural remedies, right, while they're taking certain medications. And the doctor get very, very upset because the natural remedies were interfering with the medications. Now, a couple of things about ginger. Ginger tends to lower your blood pressure. So if you're taking blood pressure medication, whether it's a beta blocker or a calcium channel blocker or a diuretic, apparently ginger can make your blood pressure go lower. So you might want to consult your doctor on that one point. And lastly, ginger stimulates the gallbladder. You might not want to take ginger if you have gallstones, especially if they're big. Now, since we're on the topic of natural remedies, if you have not seen my apple cider vinegar and lemon video, I put it up right here. Check it out. I think you'll enjoy it. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's some only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies. with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.